Hey everyone, Daniela here from the Obstacle Doc, and today we are talking about hip drop or differences in our hip musculature for abduction. So when we're talking about hip drop, we're usually looking at it in a mid-stance single leg movement. This could be on our single leg step-up test. This could also be in a running stride, walking stride, or in single leg balance. So I'm going to use the pole to kind of align where my hips are. If I were to drop off the side, if I'm trying to do a single leg squat, and I see myself kind of letting one hip go below the other, this is the hip drop that we're talking about. Same if I'm holding a single leg balance and I start to kind of go into this little sassy hip motion is what I like to call it. So when we see a hip drop from this right side, so if my right side seems to be dropping down, what I'm actually looking at from a clinical standpoint is the strength and ability of the glute minimus and medius on the left side. So those are the abductors that should be holding me in place on this left side that is kind of popping out. The other thing that we can think about is our quadratus lumborum, which is our QL for short, on the back right side, which actually helps in lifting the hip up from that dropped position. So like I mentioned, running, walking, balance, single leg stability and movements. This is where we would start to notice from side to side if one side looks really clean and then the other side starts to get a little wonky. We're going to have to look at where we can gain some of that stability or give back some of that support. We have two exercises that we can kind of go over. One is a little bit more targeted towards hip abduction, and the other one is a little bit more targeted to the QL on the backside. So this is the most basic level that I'd like to give out to begin with. This is a little bit of abduction as well as external rotation, which the glute also does. So we're kind of getting a little bit 2 for 1. I usually like to do this starting on our back. So we're going to hold one leg isometrically, and then the other leg is going to come out just a couple degrees and then slowly come back to where it started. So you're getting that abduction and external rotation while the contralateral leg is working to hold itself in the same place. So you're going to feel not just the leg that's moving, but also the leg that's holding still while you're working in this position. Important things that I like to keep in mind is not to have a choppy movement. This should be really nice and smooth coming in and coming out. Any choppiness starts to tell me that maybe we're already pushing to that tired point or that point of fatigue. And then if you switch sides, depending on which leg you start with, you might feel a little bit more fatigued on that side just because that leg was already working to hold itself in isometric position. But we like to even ourselves out. So even if it's the right leg that we've targeted to work on, we can use it and the left side as well. So as you can see, Christopher is actually holding his hands on his hips. So this is making sure that we're not letting any additional rotation come from the lumbar or thoracic spine. He's keeping himself flush on the ground while he takes this leg out and in so that his hips don't also start to flop with him, right? So all of this is just coming from a small range of motion. It's actually much smaller than you think. So I always like to tell people to start in a smaller range than to let their leg come completely out. And that's where you'll start to see the other leg come with you as well. Some people just aren't that flexible either. So we like to keep it in a really small range of motion. If this starts to get really easier, if we want to progress to a little bit of a harder level, we do have an additional video that shows the progressions in different positions for different sport-specific movements as well. All right, so this second exercise targets your QL or your quadratus lumborum, which goes diagonally on the spine bilaterally. So we are going to have a foam roller set up under our top leg. Our bottom leg is stabilizing underneath us in kind of a right angle. And what we're going to do is you're going to start in a neutral position, and then you're going to roll out the foam roller as far away as you can, which should not be very far if you think of your hip just kind of dropping down. And then he's going to pull that foam roller back up. So if you see his shirt, you can see it's kind of elongating. And then as he draws back up, similar, getting closer in space. Again, if you were to slide your hand underneath here, there's a little bit of that hip drop movement. And then as he comes back up, you see that space disappear. As your QL is working, that's where you are pulling that foam roller back towards you. You might potentially feel a difference from your right side to your left side, depending on what side maybe is being used more, less, maybe is holding more tension if it is keeping you in a somewhat hiked position. So doing both sides, again, always really important to make sure that we're not missing any discrepancies or any, ability to elongate, strengthen, and just kind of bring some of that awareness back to the muscle tissue. So this last exercise is a bit of a combination of the two. It's going to be a little bit more functional and a little bit more demanding as far as balance, because we are going to be more or less mimicking the hip drop, hip hike motion. So you're going to stand with your foot on a ledge or on a box, maybe a step. You can use some balance assistance if you need to. So a railing, a pole, something to help you stay nice and strong if you're having difficulty just even in that strict balance state. And what we're going to do is I'm going to start at neutral, drop down from neutral. You can either like tap your toe down if you can get all the way flat. I don't want you to bend this leg though. I do want you to keep that leg straight. So just think of dropping the hip down and then working on coming back up to neutral. So we drop down. We're still using this leg to help us stay pretty tall and then come back up to neutral. If that feels good and we can find neutral fairly easily, we can also come up past neutral, which is going to recruit a little bit more of that QL and a little bit more of that glute on the right side. So if I were standing on my left side, if I come up to neutral and then past, I can recruit a little bit more of that QL on my right side, more of that glute on my left side. So again, this is a bit of a combination of all three movements all two movements that we demonstrated, with the glute abduction, external rotation, as well as the QL hip hiking maneuver.